I'm Anne with Lighthouse Coding. Welcome to Medical Terminology and Anatomy and Physiology for Coding. This course will give you the foundation you need to start your medical coding education. In this course, we'll learn the basics of medical terminology and then go deeper into each body system to learn more. By the time we are finished, you'll have a solid understanding of the language used in healthcare. Before jumping into your coding curriculum, it's important to have an idea of what you'll be studying. Medical terminology is the foundation of medical coding. Throughout history, a set of medical terminology has been developed to help healthcare professionals communicate. This form of medical language is mostly derived from Greek and Latin word parts. By having a good understanding of these terms, you'll be able to predict the meaning of new words as you encounter them, and as you grow more comfortable with these terms, it will be easy for you to understand medical documentation. Let's start at the beginning with the three basic word parts. These are the root, or combining form, the prefix, and the suffix. The root is the main part of the medical term, and its job is to hold everything together. It is the central core part of the term. When the root includes a combining vowel, it's known as a combining form. The combining vowel is usually an O, but sometimes it will differ. Here are a few examples. Anter means towards the front, and the combining vowel is O. Hepit means liver, and the combining vowel is O. Go ahead and look at the list and see how the roots include a combining vowel. In the case of febra, which means fever, the combining vowel is an I. Prefixes are located at the beginning of a medical term. Prefixes define things like the quantity, absence, location, position, direction, time, or status. Think of the word prenatal. The prefix pre means before. Prenatal means before birth. Likewise, post means after, and postoperative means after or following surgery. Take a look at this table of common prefixes. Hyper means above normal, while hypo means below normal. Micro means small, and macro means large. Mono and uni both mean one, while bi, di, or diplo can mean two. There are many prefixes, and you will need to familiarize yourself with them. The suffix is a word part that comes at the end of the term. Suffixes are grouped according to their purpose, and they usually describe a procedure, condition, or disease. For example, the suffix ectomy means removal. When this suffix is added to the root word append, we get the term appendectomy, which is a surgical procedure that removes the appendix. The suffix itis means inflammation. When we add itis to the root word derm, we come up with the term dermatitis, which describes a condition of inflammation of the skin. And finally, the suffix pathy means disease. When we add pathy to the root word ner, we create the term neuropathy, which means disease of the nerves. One thing to note, if the suffix begins with a vowel, you will drop the combining vowel from the combining form and then add the suffix. Please see the handout for a comprehensive list of combining forms, prefixes, and suffixes used in medical terminology. Now that we have a basic understanding of the three word components, take a look at the terms here that show the breakdown of some common medical words. Notice osteoporosis, which has two roots, osteo and por, meaning bone, and porous, along with the suffix osis. Osis means a condition or a disease. Osteoporosis is a condition of porous bones. Hypoglycemia is made up of the prefix hypo, the root word glyce, and the suffix emia, below normal sugar in the blood. Hypoglycemia is a deficiency of glucose in the bloodstream. In the term bronchitis, we have the root word bronch with the suffix itis. Remember, itis means inflammation, and bronchitis is an inflammation of the bronchi of the lungs. Let's do a few together. I'm going to give a term. Refer to your handout if you need to, and try to decipher the meaning using the word parts. The first one is myalgia. This term is made up of the root word my and the suffix algia. My means muscle, and algia means pain. Myalgia is muscle pain. Nephrology. Nephrology is made up of nephra, which means kidney, and ology, which means the study of. Nephrology is the study of the kidneys. And the third word is glossitis. Gloss means tongue, and itis means inflammation. Glossitis is inflammation of the tongue. In medical terminology, the rules for forming plurals are different from those used in common English. Most of the medical terms have a Greek or Latin origin, and there are special rules for forming plurals in these languages. If the term ends in an A, the plural is usually formed by adding an E. If the term ends in an EX or IX, the plural is usually formed by changing the EX or IX to ICES. If the term ends in IS, the plural is usually formed by changing the IS to ES. If the term ends in ITIS, the plural is usually formed by changing the ITIS to ITIDES. If the term ends in NX, the plural is usually formed by changing the X to GES. If the term ends in ON, the plural is usually formed by changing the ON to an A. If the term ends in UM, the plural is usually formed by changing the UM to an A. And if the term ends in US, the plural is usually formed by changing the US to an I. Let's look at some examples. The term vertebra ends with an A. According to the rules, if a term ends in an A, the plural will be formed by adding an E, so vertebra becomes vertebrae when there are more than one. Appendix ends with IX. According to the rules for pluralization, if a term ends in IX, the IX will get changed to ICES, so the term appendix becomes appendices when there are more than one. Diagnosis ends in IS. When a word ends in IS, we are to change the IS to ES to form the plural. Diagnosis becomes diagnoses. Arthritis becomes arthritides. Arthritis ends in ITIS. Our rules tell us to change the ITIS to ITIDES to form a plural. The term phalanx ends in an NX. When the term ends in an NX, we are to change the X to GES. If the term ends in an ON, as in the word criterion, we are to change the ON to an A. Criterion becomes criteria. If the term ends in UM, the plural is formed by changing the UM to an A. Diverticulum becomes diverticula. Alveolus ends in US. When a term ends in US, we form the plural by changing US to I. Alveolus becomes alveoli when there are more than one. Let's try a few together. I'll give you the root word and you make the plural. The first word is bacterium. The plural of bacterium is bacteria. Bacterium ends in IUM, and we know from our rules of pluralization that IUM changes to IA to make a plural. The next word is fungus. Fungus becomes fungi in the plural form. Fungus ends in US, and we know that if a word ends in US, we change the US to I. Larva. Larva becomes larvae. When a word ends in A, we add an E. And the final word is nephritis. Nephritis becomes nephritides. When a word ends in ITIS, it becomes ITIDES. Notice the pronunciation of these terms. It's important that you learn correct pronunciation as you will be interacting with other healthcare professionals. By pronouncing the terms properly, there is less room for misunderstanding. See the student handouts for a handy reference to help you understand the rules of pluralization in medical terminology. An eponym is a term that is named after the person who first discovered it. An example is Crohn's disease, named after Beryl Crohn, who first described the disease in 1932. Here are some common eponyms and the person they were named for. You will see eponyms used in medical documentation to explain the names of diseases and procedures. In time, you will come to memorize what many of them mean, but as you are learning, you will need to look them up. Abbreviations and acronyms are used for the sake of convenience in medical language. The difference between an abbreviation and an acronym is that the abbreviation is a shortened version of a longer word, like DR period instead of doctor, while an acronym forms a new word using the first letter of each word from a phrase, like CABG, which is pronounced cabbage. It's important to familiarize yourself with medical abbreviations and acronyms, as you will see these on a regular basis, and you'll need to know how to interpret them. Here are a few examples of abbreviations and acronyms used in medical language. See the handout for a comprehensive list. Now that you've got the basics of medical terminology down, let's dive into each body system and learn more. Remember, after each section, please review the related handouts and take some time to study. Flashcards are very helpful when learning medical terminology. A little bit of practice each day will go a long way in helping you to familiarize yourself with this new language.